you're going to have this session available for you in the D2L announcements. Guys, chapter 14, blood. Blood, it's connective tissue, and it's specialized connective tissue, if you remember. And because blood is connective tissue, we have every connective tissue, we have cells, and we have a lot of cells here. We have a matrix, which is fluid in this case. That is the reason this kind of connective tissue is specialized, because the matrix is fluid. And we have fibers. Then again, the blood is connective tissue, a specialized connective tissue. Then what is the function for blood? Guys, normally we're able to transport gases such as oxygen, nitrogen, carbon dioxide through this liquid, this fluid. This is the liquid in order to transport nutrients and waste. We have embedded in this fluid some vitamins, some hormones, and some other structures, biomolecules that they're going to be useful for our life. Then blood, guys, we have a solid part, which is form elements, and we have the fluid part or liquid part, which is plasma. Form elements could be red blood cells, they are the most abundant ones. Then we have platelets, and finally we have white blood cells. Remember, platelets, the synonym is going to be thrombocytes, red blood cells, erythrocytes, and white blood cells, leukocytes. Then among the white blood cells, remember, we have neutrophils, they are the most abundant ones. We have eosinophils, basophils, monocytes, and lymphocytes. Now, regarding the plasma, we have mostly water. 92% of the plasma is going to be water. And electrolytes such as sodium, potassium, calcium, magnesium, zinc, all of them are in plasma, are in our plasma. Guys, we have a huge component in our plasma, which is proteins, and they are very important. Albumins, mostly of them, if you remember, they are the magnet for the blood. We are able to keep our blood inside of the blood vessels because of the albumin. The albumin is the oncotic pressure to the magnet, again, to keep our blood inside of our blood vessels. Then we have globulins, and these globulins could be alpha, beta, gamma. Alpha and beta, they are for transport of hormones, for example, and other substances. But globulins, the most important ones are the alpha, the gamma globulins. Gamma globulins are antibodies. They are our defense against infections. And we have the other kind of protein is fibrinogen, which is 4%. And these fibrinogen is useful because it's necessary for clotting, blood clotting. We have some wastes in our blood. We transport nutrients, vitamins, hormones, and the main function is the transport of gases, such as oxygen, carbon dioxide, and nitrogen. Guys, again, we can divide our blood in two parts. After centrifugation, when you draw blood, then you put that blood in a tube, and then you put that in a centrifuge. If you remember our experiment number 2 in the lab manual, we were centrifugating our blood 3,000 revolutions per minute. It was during 5 minutes, and then we were able to separate this blood in two parts: the liquid part, plasma, and the solid part, the formed cells. Remember, between them, we're going to have this buffy coat, and here it's less than 1% of the whole blood, and it's going to be only white blood cells and platelets. Again, the buffy coat, which is the layers, really thin layer separating the plasma, which is the liquid part, from the solid part, and this one is less than 1%. The rest of it, On the bottom, it's going to be really dark red, and it's going to be red blood cells. And again, it's the package of red blood cells. This is called hematocrit. We're going to talk about later. And it's 45% of the blood. Then, if you remember to calculate the hematocrit, we can divide. Actually, I'm going to stop for a second here in order to show you. You can divide the amount of red blood cells. If you can see here, for example, if you have here, I don't know, it could be 45 millimeters divided by 100 millimeters. This is going to be 45%. And this is the way to calculate hematocrit. And remember, the hematocrit is going to be the package of red blood cells in our blood. Then, guys, we have these three kind of four elements. This is the smear. This is the representation for the blood smear, the human blood smear. Then we have red blood cells. Again, they are the most abundant ones. Then we have these pieces, cytoplasmic pieces of cells. They are fragments, small fragments of a cell called megacardiocyte. And these are white blood cells. Guys, as you remember, I always tell you what is really important for your practice and what is not very important. This one, it's important for the lecture exam, but not for life. But it's important you know. Guys, these are cells. These are cells, form elements of the blood. But these guys, they have precursors. Then the grandfather cell is the stem cell. Then you have these have two daughters, myeloid cell and lymphoid cell. Only if you remember the classification, agranulocytes, such as lymphocytes and monocytes, they are children of lymphoid stem cell. And the rest of them, erythrocytes, platelets, and granulocytes, are granddaughters of the myeloid daughter. Then here, the important thing to remember, you have erythrocytes. They are the only mature cell enucleated. They don't have nucleus. They don't have mitochondria. Again, red blood cells are the only cells in our body, mature cells, without nucleus and without mitochondria. Then they are myeloid line. We have platelets again. We have platelets. They are not cells. They are pieces, cytoplasmic pieces of this cell. And this cell is called megacardiocyte. It's this one. And we're going to have small pieces of cytoplasm. Then we have another granddaughter from the myeloid stem cell. These are granulocytes. If you remember, these are white blood cells with granules. Then we have no colored granules, reddish granules, and bluish granules. Then they are neutrophils, eosinophils, basophils. Again, they are white blood cells and they have granules. They are called granulocytes. Then they are neutrophils, eosinophils, basophils. Then you have the granddaughters and grandsons of the lymphoid daughter. And you have agranulocytes. And if you remember, it's only two, monocytes and lymphocytes. Lymphocytes, they could be T cells or B cells. We're going to talk about that later. First of all, the first cell, again, enucleated cells and without mitochondria, is the red blood cells. Guys, erythrocytes are in charge of the transport of gases, such as oxygen and carbon dioxide. This is a normal shape. It's rounded and it's biconcave. Guys, when in our body we need oxygen, we lack oxygen in our blood, we have low blood oxygen, which is called hypoxia, then we need to increase the number of red blood cells in order to transport more oxygen to our tissues. Then we send that message to our kidney. In our kidney, we have a hormone, and that hormone is called erythropoietin. By the way, you're going to read many times erythropoietins or EPO. EPO. EPO, it's erythropoietin. Then when you send erythropoietin through the bloodstream and then reaching the red bone marrow, you're able to produce more red blood cells. When you increase the number of red blood cells, you're able to increase the amount of oxygen that you can deliver to your tissues. Then, when you produce more red blood cells and you have enough oxygen, then you decrease the production of EPO. That's a way to control the amount of oxygen in our tissues and to control the number of the erythrocytes in our blood. Guys, sometimes we have red blood cells with different shape. If we have some diseases such as thalassemia or sickle cell anemia, those diseases, those conditions, they have different shape for the erythrocytes, the red blood cell. Then instead of being rounded, you cannot transport oxygen here. Then because of that, you're going to be producing more and more red blood cells. But because they're abnormal shape, they have a normal shape, they are not able to transport enough oxygen. Then this is a cause of anemia. Again, when you have different shape, like this one, this is a sickle cell, then you're going to be not able to transport enough oxygen. Guys, in order to produce erythrocytes or red blood cells, we need EPO and we need some other nutrients such as vitamin B12, iron, folic acid. By the way, the most common cause for anemia is going to be the iron deficiency. Then our food, our nutrients such as vitamin B12, iron, folic acid, vitamin C, very important as well, all of them are important to produce hemoglobin, and hemoglobin, it's in order to form more red blood cells. Sometimes, guys, if you compare these red cells with these pallid cells, they are pale, then you're able to say we have no enough hemoglobin here. This is anemia. This is anemia. And sometimes you can see different shape of red blood cells. Guys, then the decreased number of red blood cells is going to be the decreased concentration of amount of hemoglobin in your blood. That is anemia. Then you can have decreased number of red blood cells and then anemia if you have an hemorrhage, if you have bacterial infections, if you have deficiencies in the nutrients, what you have to form the red blood cells. If you have decreased hemoglobin concentration, again, the most common cause of iron deficient anemia, the anemia is going to be iron deficiency anemia. Then you can have malnourishment, you can have heavy menstruation, women can have heavy menstruations, persistent bleeding ulcer. All of them are causes for decreasing the hemoglobin concentration. And as I told you, you can have different shape of red blood cells. And the different shape of red blood cells, we're going to have abnormal hemoglobin. And these conditions, such as sickle cell anemia that I show you, in here, you can see here, sickle cell anemia, you can have a different shape of the red blood cells. Then, or another kind of diseases is thalassemia. These are because we have abnormal shape of the hemoglobin and then a normal shape of the red blood cell. Guys, normally what we have inside of the red blood cells is this protein, is this structure. This is hemoglobin, the hemoglobin molecule. And as I told you during our session on Tuesday, was we have the hemoglobin has 2 chains alpha, 2 chains beta, and in the middle we have the group M with iron. And you can see here 2 chains alpha, 2 chains beta, and in the middle we have the iron. And this group M is going to be fixing our oxygen. It's going to be fixing our gases. Guys, normally this is the cycle of a red blood cell. The lifespan is going to be around 120 days. Normally we absorb the nutrients in our small intestine, and then we send those nutrients through the blood to our epiphysis in our red bone marrow, in our bones. Then we're able to produce more red blood cells. They're going to be circulating in our bloodstream for 120 days. And then when they are almost dead, they are going into the spleen, and then they are going to the liver to be decomposed, to suffer apoptosis. Then they are decomposed. And finally, they're going to be converted, becoming in bilirubin. Then we can eliminate bilirubin or bilirubin through the urine. This is the lifespan or cycle of a red blood cell. Again, this is important to analyze. We need to absorb iron. We need to absorb nutrients. We're able to produce more red blood cells in our red bone marrow. And we have the graveyard of the red blood cells after 120 days is going to be our spleen. And we're able to decompose the hemoglobin here in liver. Guys, now we're going to talk a little bit about white blood cells. If you remember the function, the main function of the white blood cells or leukocytes, which is the synonym leukocytes, they are in charge of our protection against infections. Then they have several functions. For example, if we have imagine we have an infection, it could be, this is the place for infection. We have infection here, we have bacteria here, we have an infection here. Then we're going to need some white blood cells to attack these bacteria here. Then we have a lot of bacteria here, and we need these bacteria being attacked by white blood cells. Then they need to cross from the blood vessels into the tissue. This function to cross these blood vessels to go through those blood vessels is called diapedesis. Diapedesis is the property of a white blood cell to cross, to go through the wall of these blood vessels. Remember, capillaries, they only have one layer. It's going to be the endothelium. Then they have this fenestration, they have this hole, these pores. Then we're able to leak some white blood cells in order to attack this place for infection. This is called, again, diapedesis. Let me move now here. Guys, when you have a wound, for example, it could be any source of infection, but when we have a wound, it could be we're crossing our skin, and remember the skin is going to be the first barrier against infections. But if we have, for example, this wound, small wound, then we're able to acquire more bacteria. They're going to be growing around the wound. Then we need more defenses against that infection. Then we're going to have in your cells losing histamine and increasing the permeability of red blood cells, or sorry, of the blood vessels in order to become leaky. Then, when we have, I'm going to show you, when we have a blood vessel, that blood vessel is going to be more leaky, and we're going to have more diapetesis because these cells are releasing histamine, and that histamine is becoming more leaky. These blood vessels are leaky, then we can cross easily. We can go through the wall of blood vessels in order to get more white blood cells in the site of infection. Guys, remember we have 5 types of white blood cells. The most common one, neutrophil. They generally have a nucleus divided in several lobes. It's a polymorphonucleated, and these granules, they are not red, not blue, they are neutral. Remember, pH neutral. Then they don't have color, specific color. These are the neutrophils. These are the most abundant ones. 50 to 70% of our white blood cells are neutrophils. This is the neutrophil. When you have more than normal, that is called neutrophilia. And one cause for neutrophilia is bacterial infections. When we have infections caused by bacteria, then we're going to have for sure more neutrophils. Another kind of granulocytes, by the way, this is a granulocyte. It's a white blood cells with granules, but these granules, they have no specific color. Then they are granulocytes. Another kind of granulocyte is going to be are eosinophil. They have granules inside, reddish granules. And these ones normally 1 to 4%, 1 to 4%. If we have more than normal, if we have, for example, 10 or 20% of eosinophils, it's because we can have allergies, allergic reactions, or parasites, such as tapeworms. Then if we have infestations with tapeworms, or if we have asthma or any other kind of allergic reaction, we're going to have increased number of eosinophils, and that is called eosinophilia. We have neutrophils, neutrophilia, and now we have eosinophilia. Then we have this one with granules as well. This is the less common white blood cell, and this is called basophil. And this one has dark blue-ish granules inside. Then again, it's the less common, it's less than 1%. And inside of them, they have granules with heparin and histamine. They are going to be active when we have inflammation processes, then especially when we have chronic inflammation processes. That's the reason you're going to see this, for example, in conditions such as TB, tuberculosis. In tuberculosis, you're going to have more basophils. Then you have white blood cells. This is a massive one. This is the biggest one. This is the largest one. But this time it's with no granules. This is 1A granulocyte. Then because we have a granulocyte, this is massive. This is the largest one. And this has this nucleus. Can you see here? We have a nucleus with a shape of a kidney or a bean. This is the shape. Then you have, guys, this is the important cell when we have infections, and we're going to have these cells going through the blood vessels and then phagocytizing the exchange bacteria or cells. Then these are phagocytes or macrophage cells. Macrophage. Again, they are called monocytes in the bloodstream, but usually they go through the blood vessel, they locate in the tissue, and they are called macrophage. This macrophage is for phagocytosis. They are engulfing particles, they are eating solid particles, such as bacteria and some other strange particles. And finally, we have the lymphocytes. It's the smallest one, white blood cells. Actually, if you can see, it's almost the same size of the red blood cells. This one, it's a huge nucleus. Again, this is another agranulocyte. We have no granules here. And this kind of cell, the lymphocyte, could be B cell or T cell, B as in boy or T as in Texas. B cell is the producer of antibodies, and a T cell is the cellular response of the immunity. B cells from Borsa of Fabricio or from bone marrow because they are maturing on the bone marrow, and T cell as in Texas because we use the thymus. Thymus is a gland that we have in our mediastinum when we're kids, especially before puberty. We have a gland called thymus, and that thymus is for maturation of T cells. Again, B cells are for humoral response, production of antibodies, and T cells, as in Texas, they are for cellular response of immunity. Guys, here a summary, a very good summary. When you have elevated lymphocytes, you need to think first in viral infections. Viral infections. But you can have leukemia, whooping cough, mononucleosis. When you have elevated eosinophils, you're going to have maybe a parasitic infestation or maybe an allergic reaction. When you have elevated monocytes, remember, you're going to have inflammation. Then you're going to have chronic inflammation such as tuberculosis, or it could be present in malaria or typhoid fever. When you have elevated neutrophils, which is the most important white blood cell, you have bacterial infections. And these bacterial infections, every single time you're going to have neutrophilia. And when you have lower amount of T cells, especially lymphocyte cells, you need to think this patient could be a patient with AIDS. Guys, this is the summary for your blood cells. I'm going to stop sharing with you my screen for a second. I would like to show you some specific things about blood cells. Give me a second, guys. Maybe some of you have this information already, but I would like to remember you some specific things. Can you read this in your screen? I hope so. Then I hope you can read this information. Let me know in the chat if you can read this information, guys. Let me know in the chat. Let me know in the chat if you can read this information. Guys, let me know in the chat, please. Any of you, Valeria, Osvaldo, Brianna, Fatima, Jasmine, can you read this information? Kind of. Okay, let me take the information closer. Gonna be a little bit different this time. Now, can you read it? Okay, I'm gonna try to do my best here. Okay, guys, red blood cells. Normally, we have hemoglobin of 12 to 14 grams per deciliter. In women, we have 14 to 16 grams per deciliter in men. If you have low concentration of hemoglobin, that is called anemia. Normally, you have another measure, which is hematocrit. Your hematocrit usually it's, let me change that a little bit, that way it's going to be better. Hematocrit is going to be usually 3 times the hemoglobin. And the number of red blood cells is 4 to 7 millions per millimeter for cubic millimeter. Guys, if you have more than 7 millions, it's going to be polycythemia. And again, the function for red blood cells is transporting oxygen and gases. Then you have another kind of cells. Platelets. Remember, they are not cells. They are pieces, cytoplasmic pieces of cells. And they are, the normal value, 150,000 to 450,000 per cubic millimeter. Then when you have below 150,000, that is called thrombocytopenia. When you have more than 450,000 per millimeter for cubic millimeter, then you have thrombocytosis. Remember these terms because we're going to be using these terms every single day in your professional lives. And these function, these pieces of cells function is the blood clotting. Remember, our clotting is when you have three processes. We're going to be talking a little bit in a moment. Vasospasm, plug, platelet plug, and coagulation. And then you have white blood cells. Regarding white blood cells, you have 5 types. Neutrophils, 50 to 70%. Eosinophil, 1 to 4%. Basophil, less than 1%. If you have more than normal, it's going to be Neutrophilia, and that is typical for bacterial infection. Remember, we're going to have a nucleus divided in several parts. It's polymorphonucleated, and we're going to have dots inside, granules inside. We know color definition. Then we're going to have red granules, eosinophil. Eos is going to be reddish. Then you have reddish granules inside, and these granules are cytotoxic, and they are attacking specifically tapeworms, parasites, and they're going to be elevated in parasitic infestations and allergic reactions. Then we have basophil, less than 1%. Specifically, they're going to be useful when we have chronic inflammation conditions such as TB. Then we have 2 white blood cells with no granules, and they are monocytes and lymphocytes. These 2 white blood cells with no granules, they are elevated when we have infections or inflammations such as monocytes. Remember, when we have monocytes in our bloodstream, it's called monocytes, but when we have monocytes in our tissues, it's called macrophage. Macrophage. And finally, we have lymphocytes. Lymphocytes are 30 to 45%. They are really increased. We have lymphocytophilia or lymphophilia when we have viral infections. Infections caused by virus infection, viral infection. Guys, when we have low amount of T cells, we can think in patients with AIDS. Remember, guys, white blood cells are leukocytes, and normally we have 5,000 to 10,000. When we have less than 5,000, that is called leukopenia. And when we have more than 10,000, that is called leukocytosis. And we have leukocytes, leukopenia, and leukocytosis. I think this can be useful for you guys. We're going to be using these terms for sure in your exam, and later you're going to be using that for life. I'm going to share with you my screen again because we need to cover some other aspect of cells and of blood. Guys, we already got the cells, the formed cells, the formed elements, the cellular elements. Now we're going to talk a little bit about plasma. If you remember, I told you mostly is water. 92% is water. But some other components are really, really important. For example, albumins. We have proteins, and you have 7% of your plasma is going to be proteins. Then albumins is the most abundant protein in your plasma. And remember, this is going to be the magnet. You are able to keep your blood inside of your blood vessels because of the albumin. And there are 60% of the proteins in your plasma. Then you have globulins, and you have alpha globulins, beta globulins. They're useful for transporting substances such as fat, hormones, and the most important ones are the gamma globulins. Gamma globulins, they are antibodies. They are the most important proteins in our plasma. And finally, we have 4% of our proteins are fibrinogen, and this one is for blood clotting. This one, it's becoming later. Let me write it down here. This one is becoming later in fibrin. Fibrinogen is going to be later fibrin. And fibrin is the net we're going to have on the hole when we're bleeding. Then fibrinogen becoming fibrin is the most important step, the most important protein that we have for blood clotting. I'm going to show you later that. Give me a second, guys. I'm going to stop here my annotations. Okay. This is very important, guys. You can see here 3 steps of blood clotting. Normally, we can have damage of any blood vessel. That damage, it could be external or internal. For example, if we have a wound, we have an external damage for the blood vessel. It could be a small blood vessel such as capillaries, or it could be a medium-sized vessel such as an arterial or a small artery. This is effective for every single blood vessel, but when we have huge blood vessels such as the aorta or maybe a big vein, we really to trouble clotting, stopping the bleeding. When a damage that could be from the external part, like a wound, or it could be because an internal damage. For example, if you have a condition called vasculitis, because it's the inflammation of the blood vessel, or if you have a plaque made of fat inside of the blood vessel, then you're going to have the same process because you're damaging the blood vessel. Then the first step is going to be when you have a blood vessel with any damage. Again, it could be because external causes or it could be because internal causes. Then you're going to have a lot of blood vessels with constriction. If you have a pipe and you're leaking liquid, fluid out of the pipe, you need to close the pipe. Then the first reaction is going to be vasoconstriction or vasospasm. Actually, let me type this. The first is going to be vasospasm. It's the contraction, the vasoconstriction of the blood vessel. Then that is because we have our platelets. Then when we have a bleeding, our platelets, they're going to release a substance in order to constrict the blood vessel. The second stage is going to be a plug. Then we have a group of platelets. They are stuck in the place, stuck in the hole where we have the wound, where we have the damage. And they're going to be all together. This second stage is called platelet plug. Then first of all, we're going to have vasospasm. And then we're going to have a platelet plug. This is going to be controlling our blood loss. Finally, we have a third step here. And you remember, I told you for fibrinogen is the protein for, you remember I told you fibrinogen is the protein for blood clotting. Then fibrinogen becoming fibrin is going to be a net. And that net it's fibrin. This is fibrin, guys. This yellow net you have here, it's fibrin. It's a net containing all of these clots. It's the structure of the clot. Then you're gonna have in a clot a lot of platelets, a lot of red blood cells, and that net, that protein net. Again, fibrinogen becoming fibrin is the most important step to stop a bleeding, to stop the bleeding. And again, here you can check your steps. Vascular spasm is going to be the first step. Vascular spasm, you need to decrease the size of the blood vessel. Guys, I'm going to stop sharing with you my screen for a second. Do you have any questions? Do you have any comment? I was reading something here. I don't remember. Okay, I have no comments here. I'm going to share with you my screen again. Then we have three things, guys. Vascular spasm, which is closing your blood vessels. You have a blood vessel which is leaking, then you need to close. You need to move, to contract that blood vessel in order to close that leaking. Then you have a lot of platelets. They're coming from everywhere, and you're receiving more and more platelets in that place. That is going to be a plug formation. You're going to have a group of platelets all together in order to stop on the hole. And finally, you have the fibrinogen becoming fibrin, which is the damage, which is the net containing the damage. Again, vascular spasm, platelet plug, and blood coagulation are the three steps for coagulation. Give me a second, guys. Guys, again, there are some knowledge useful for life, and there are some knowledge useful for exams. This one particular knowledge is for exam, and I'm gonna share with you this knowledge. Guys, normally I told you we have internal damage of a blood vessel or external damage of a blood vessel. We have 12 kind of proteins. They are called coagulation factors, and they are important when you consider only the type of damage. Then you can activate your coagulation because of the intrinsic mechanism. Then you have a internal damage of the blood vessel, or you can activate the clotting mechanism because of a wound or an external damage. Finally, the most important step is going to be fibrinogen becoming fibrin. But for the exam, you need to know you have 12 proteins. These 12 factors are called clotting factors. All of these factors are important in order to reach that net, that clot. I don't need you to know the names, but I need you to know we have an intrinsic pathway and extrinsic pathway. Again, internal damage and external damage. And finally, the most important step is going to be fibrinogen becoming fibrin. That is the most important knowledge you need here. As you can see here, guys, we can have the blood vessels. This is the lumen. This is the artery wall. Remember, we have here the endothelium. Then you have this wide wall, which is the muscle. This is a normal blood vessels. But sometimes our blood vessels, they can have external damage or internal damage. As you can see here, this is a plaque full of, it's filled with fat. It's made of fat. And then we're reducing here our lumen. This is bigger, this is wider, and this is narrower. Why? Because we have fat. Then this internal damage is able to wake the coagulation system up. It's able to stimulate our coagulation. Then we can have, again, external damage or internal damage. Guys, I would like to show you the final part of our session, and it's going to be something about blood typing. As you can remember, guys, we have four types of blood. We have type A if we have antigens A, type B if we have antigens B, type AB if we have antigens A or B, or type O if we have no antigens. And this is the most common, by the way. In America, type O, it's for every single population. It's the most common, type O. And then, guys, again, this is going to be depending on the antigen. If you remember, the antigen is the exchange particle. When we have exchange particles able to wake the immune system up, that is an antigen. Then the most common antigen is having no antigens, type O in America. And these are antigens. When you see a molecule, usually this is going to be a carbohydrate. This molecule is going to be a carbohydrate. On the surface of the red blood cell is going to be an antigen. And this type of blood, type A, we have antigen A, but we have in our plasma antibodies against B. Again, type A blood, we have antigens A, carbohydrates on the surface of the red blood cells, but we have proteins. These are antibodies, proteins. If you remember, I told you gamma globulins are proteins, they are antibodies. Then type A, they have anti-B antibodies. Then we have, for type B, we have the opposite. We have antigens B and anti-A antibody. Can I receive type A blood if I'm type B? No, because they have antibodies against my blood, and I have antibodies against their blood. Then we have AB blood, and this one has two types of antigens, both carbohydrates on the surface of the red blood cells, but they don't have antibodies. They don't have proteins against anybody. Then they can receive any type of blood because they don't have antibodies. They can receive any type of blood. They are universal receptors. On the contrary, we have type O. Type of blood, we have no antigens on the surface. We have no carbohydrates on the surface, but we have anti-B and anti-A antibodies. We have both antibodies and we have no antigens. We can give blood type O to any patient, but they only can receive type O. They are universal donors. They are universal donors. Again, A, B are universal recipients, and type O are universal donors. Again, type A, antigen A, but we have antibody, anti-B. Type B, we have antigen B, and the antibody is going to be anti-A. When we have group AB, it's because we have both antigens, but we have no antibodies. And finally, type O is because we have no antigens, but we have both antibodies. Then, guys, when we have this type A cell, this is type group A, we cannot have blood with antibodies A because we're going to have agglutination. And this is the view. We're going to have some mini clots here. This is called agglutination. And if you remember our session, you can see these mini clots. Then when you have these mini clots, this reaction is called agglutination. Agglutination. Guys, this was useful years ago because we were able to determine paternity with this test. And obviously, 100 years ago, we couldn't save more lives because we couldn't use transfusions to save lives. Today, we can do it. Guys, we have another uh, antigen, which is antigen D. And we discovered that in a monkey. And that monkey is called Macacus rhesus. I'm going to show you here. Macacus rhesus. That's the reason we call this antigen D, we call that RH. And we can have it, it's going to be positive, or we cannot have it, it's going to be negative. If we have the antigen, we are RH positive. If we have no the antigen, we are RH negative. Then we can have A group and RH positive, A group and RH negative. We can be A positive, A negative, B positive, B negative, AB positive, AB negative, O positive, and O negative. Guys, this is important. Why? You have a specific condition, and it's going to be with mothers and babies. When you have a mother, which is RH negative, and you have a baby, which is RH positive, that mother, when they have connection, maybe during the pregnancy, it's impossible because of the placenta. But when we have the delivery, it could be normal delivery, a natural delivery, or it could be a C-section. We're going to disrupt that protection of the placenta, and we're going to interchange blood. Then this mother is going to develop some antibodies against the baby. That's the reason we use some vaccines, and these vaccines are called Rogan. We use this vaccine at the beginning of the pregnancy and at the end of the pregnancy. Rogan, which is the gamma globulin, we use that to avoid this condition, and this condition is called erythroblastoma fetalis. When we have a mother sending some antibodies against the baby blood, it's going to be this condition, erythroblastosis fetalis. And this condition is prevented because we have Rogan, is vaccine or gamma globulin against this phenomenon. Again, it's going to be starting on the second pregnancy, and it's going to be only when we have a mother, which is RH negative, and we have a baby, which is RH positive. Guys, I think this is going to be the end of the session. Let me check. Yeah, it's going to be the end of the session. Guys, I would like to know if you have any questions so far. It's going to be really important, especially regarding the exam. I'm going to stop recording now, and I'm going to ask you again if you have any questions, guys, any question that you have out there.